listening to Sharon Garrett, and I'm joined by Dr. Mr. Atari, who's the Chief Executive Officer of Medcare, and we've been discussing the importance of the new JCI accreditation in UAE hospitals and some of the new regulations that the Dubai Health Authority has introduced. I think let's go back and touch on some of those other things. First of all, we were discussing the importance of continuing professional development for doctors and nurses. What other kinds of regulations are coming in?
The credentials also now, they are looking at different credentialing for doctors and nursing, different way of interviewing, and also ranking. In the past, it used to be only a general practitioner or as a specialist, and that made it very we didn't give the patient the right to know what level is this doctor from. But now they are introduced registrar, consultant, so now there is some differentiation. So the patients are more safe. They know who to go to. The other thing that is done by the Department of Health and the Health Ministry is all the advertising, the false advertising. Basically, there is more monitoring now. They are looking into,
Are you saying we've got false advertising in Dubai?
Some. Or it used to be at least, but now with the new regulations and now Ministry of Health is taking care of a big part of that, I'm sure they will make sure that everything goes through. It will be to the benefit of the consumer, the patients, because there is so many and nobody knows which is true, which is not.
What happens with your ads at the moment in the health industry and hospitals? Do you have to pass them by the Ministry of Health?
Now everything has to be submitted to the Ministry.
What's the penalty if you don't?
No, you cannot actually post it anywhere without the approval of the Ministry of Health. And if you put something without the approval, or you put some word that after the approval, you could be fined 5,000 to 10,000 and much more to that.
This is great.
This is absolutely fine. I mean, as they said, they are moving to the right directions in that aspect, basically.
Looking at the JCI accreditation, which you managed to get in just under a year, the Medcare hospital, were your hospital records audited as part of the process? Do they go through absolutely everything from the person that signs in, the patient signing in, to their exit? What about post-operative infections? Do you keep a track of all of that?
Absolutely. Actually, there is in the standards in JCI, there is a core standard and there is other standards. The core standard is either you pass or you fail, and if you fail, you're done. You don't pass. One of it is patient records. Patient records is the most important in this whole process to make sure that everything is written neatly, everything, the doctor, the nurse, all the notes.
How do you achieve that when doctor's handwriting is really bad?
Actually, one of the things, it has to be very legitimate. You can read it. So it has to be legible. Yes. It has to be legible, and everybody has to be able to read it. And they actually promote that people dictate and type and all that, because this is one of the problems. Signatures, the stamps, and everything. So they go through everything in the patient file, from where to put it, where to sign it, what to do with it. It's complete package. They're really very thorough in that. We're talking about infection. There's one, when we were inspected, there's one, I think it was the nurse and the doctor. Her job for one day is looking into infection policies and procedures. So it was very, very important aspect of that. It's not just, okay, what's your policy and procedure? They wanted to see record.
They want to see that you're carrying it out.
Yes, they're looking at it. Okay, what did you do with every patient where you had infection with? They're not saying we never had an infection, but they'll say how to minimize it. And what do you do after you find it? How do you eliminate it from the next time it's happening? So they give you a full, not just, okay, you cannot do this, but what's the solution? They educate you into what is the best practice in this industry.
What did you find? Were they helpful during this accreditation process? Were there some parts which, because you're a new hospital, you hadn't come across yet, but they gave you guidance on? What kind of things would that be?
Absolutely. They were very, very helpful. It wasn't, as they stated from the beginning, it's not an audit that you will fail or we have to penalize you. You actually paid us to come and inspect you.
So this cost you money?
Definitely. Actually, you paid them to come and tell you you're doing it wrong.
How much money does it cost?
It's a lot.
You're not going to give me a figure. Is it digits?
It is a big process, but when what they're looking for, actually, you're paying to educate you too. So I don't want them just to say you're doing it wrong and to leave. They want to say it's a small education process every day. They brief you and tell you this is the way. And they're open afterward. After they accredit you, they're available for you to ask questions and do better practice. And good thing about them, the regulations changes. It doesn't like, okay, if it's one standard, then I study for it and I pass. But every year they have new standards and new policies.
Do they re-audit you? Because sometimes we get accreditations and we just have them, and then you've got it, then you have the logo, you can have it on your letterhead and everything else. But how often is the re-audit process to ensure that you're continuing with those good traits, following those procedures, great record keeping, so on and so forth? How often to keep your accreditation?
As a policy, they come every 3 years.
Okay.
But also that does not guarantee that every 3 years only. If they feel that there is a need, they will come back and visit you.
What would prompt them to think there was a need?
I think, I'm not sure exactly what their Howard's policy, but if they feel that they do it sometimes just to feel that all the accredited hospitals are still in the same path. If they feel that there is some hospital is not, they will come back and audit. And I know for sure that they will do even the safety to that. But in general, every 3 years, you have to re-accredit it again.
Are they really mean with the audits? Do they tell you when they're coming, or do they just do surprise visits?
No, it is a plan. It is a plan visit. That would be very, very, very hard to do it. No, so it would be difficult.
It would be difficult, but it would keep you on your toes, wouldn't it?
Absolutely.
It would definitely keep you on your toes. Well, thank you very much for coming in. Ala Atari, who is the Chief Executive Officer of Medcare Hospital here in Dubai, and they proudly achieved the JCI, which is the Joint Commission International Accreditation, in less than a year. Usually takes up to 2 years. So I guess all of our listeners can be assured if they go to the Medcare Hospital that you are working under a really nice best practice framework. Keep it here on 103.8. After this break, we're going to be talking about how bereavement affects children.